So I'm Lindsey Long. I am Regan Rouse's bestie. I am a mom to two amazing girls who are my stepdaughters, aka my daughters. They have a wonderful mom as well, and I just married their dad 3 days ago.
I was there.
So very exciting, very exciting. I grew up in the Littleton, Centennial, Colorado area with Regan, and I am currently living in the Ann Arbor, Michigan area as a general pediatrician. And I've been in practice now for about 9 years outside of residency, and including residency, I've been doing this for 12 years.
It's amazing. And tell me why are you a pediatrician? What took you there?
So I always knew that I wanted to do something within medicine. I thought it was going to be veterinary medicine for the longest time. And then I really fell in love with the human body and interest in human medicine in college. And so I went that direction towards pre-med and was looking around. I had a lot of interest in a lot of different aspects within the medical fields, and I just landed in pediatrics that I was like, these are my people. Being able to help to diagnose, treat, care for kids was just such a natural thing for me. So I loved it, and that's what I felt like this was more of a calling than it really was.
I actually don't know that I've heard you say, and we've talked so much about your job and about all the things around it, you call it a calling, and that makes me feel really 100%. Good because I feel that way. And watching you as you've transitioned from med school to residency into full-fledged, passionate doctor has been a really big joy for me. I'm fine. But what I love so much about what you do as a doctor is how very passionately you feel about your patients and how you are committed and totally, you're all in with each one of your patients. And that's something really special that unfortunately I don't think is across the board true. And not to say all doctors aren't in it for the right reasons, but everything you do, you're all in, and I love that.
Thank you.
So, which is why I wanted to talk to you about this, because I know you have a lot of opinions and a lot of experience.
I do. It's a freaking privilege to be able to do what I do.
Yeah.
It really is. Like, people entrust me with so much information about who they are. They're like, to the depths of the things that they worry about, that they're scared about, that they're excited about. Like, they share different things with me that I don't know that they necessarily share with a lot of other people, especially someone who sees them, potentially like, once every 2 months, once every 3 months, once every 6 months, a year. Mm-hmm. And I know their families. They share so much with me that's privileged information.
It
so
is.
I very much take that into consideration with what I get to do for a living. It's really special.
It is really special. And I want to get into the meat of postpartum mood disorders, the postpartum timeline, how there's a little bit of a misconception about how postpartum depression, anxiety presents itself. It's so different for each patient, for each mom, for each dad. And we'll dig into all of that. But before you became a pediatrician, did you have an understanding, or even really, was it on the radar, postpartum mood disorders?
So when you were talking to me about this, the first thing that came to mind was the only thing that I really remember growing up was hearing about Brooke Shields and her putting out a book about what her experience was, with postpartum depression and what that looked like. Mm-hmm. And I remember the bravery of her coming out with saying, like, this happened to me. This is something that I've gone through. I love my kids so much, but this is something that I've gone through. Mm-hmm. And I remember that there was such a backlash from Tom Cruise saying, may I reference?
I think so.
Because I was looking back into this, I just remember that he kind of like poo-pooed all over this. And apparently he had said that, let me find it, she was dangerous for spreading irresponsible misinformation, and that all we need to get through postpartum mood disorders is vitamins.
Do you know around what year did Tom Cruise come out saying that?
I think it was 2005.
Which is very recent if you really take a look. Yeah. So in your experience now as a doctor, what are you actually seeing in real time?
Yeah, so I think, and honestly, I will go back really fast. I don't even remember all the things that Brooke Shields said. Mm-hmm. I don't remember all the symptoms that she was talking about, but she was just laying bare her experience of saying, this is something that happened to me, and I never thought that this would happen to me, and I had wanted my children so badly, and so I didn't understand why this was happening and why this wasn't one of like it wasn't only joyful for me. There were other things that went along with this, and I didn't understand why this was happening. I remember her saying that because she loves her kids so much, and she's such a great mom.
Yeah.
The only other reference that I would have to postpartum depression was the worst of the worst of the worst stories of, like, what was it, Susan Smith or something, who had drowned her children in a lake. Like, those were the stories that I remember hearing. So then it was like, how could a mother ever do something like this? And then later things were coming out about the fact that she had been seen by physicians for really severe postpartum depression. And so that's, I think, in societal, like, vernacular, like, this is what postpartum depression looks like. It's like the most severe cases of, it's harming your children. Like, this is what this looks like, or desires or thoughts of harming your children.
I'm
and
so
it's
glad
not always that
you bring that up, actually, because I'm finding in my conversations with people, that's what they think. When I say I had postpartum depression and anxiety, they assume that meant that I wanted to hurt my children.
Correct.
There are all these symptoms outside of that. Tell me about those. What are the other symptoms that are actually more prevalent? Because what we're talking about with harming your child, that's psychosis. That's the most extreme version of postpartum mood disorder.
Yeah, harming yourself, harming your child.
There's so much more.
So much more. You know, what's really interesting too is, like, the way that I was trained in residency as well was, like, there's a difference between the baby blues and postpartum depression, but is there?
but we don't really know what those are.
Right. Because really, it is exhausting, right? Like, after having a child, or, and that's the thing, I know that there's so much that's talked about, like, it's hormonal fluctuations, it's fatigue, it's, you know, it's overwhelming, it's, you know, all these emotions all at once. But I don't know that it has to be just people that have given birth. Could this not be something that also happens to adoptive parents when they're put into, hey, we've adopted this child? Does it have to be an infant? Could it be a young child? Could it be a teenager, of saying, like, whoa, we are really struggling here? Is there, so I think it's really interesting, because I was trying to look up earlier, like, what is the exact definition of postpartum depression? Because I don't know that it's going to be you know, for the first 6 weeks, that's all the postpartum depression is. It's having a mood disorder or anxiety after, I think that idea of, like, after having a child, right? But I don't know that there necessarily needs to be a definition of what a child is, right? What age a child has to be, or what the birthing process is, or a matter of time in between.
Right. But how do you qualify?
Right.
And unfortunately, it never has been clearly qualified. And what is out there for literature can sometimes contradict each other, or be very confusing because they're saying one thing over here. The statistics keep changing. So when you're seeing some families come in to see you for a visit after they've had a baby, what is that looking like? And are you able to see some of those? Are people coming to you and opening up? What does that look like for you?
So it's kind of, it runs the gamut. I will tell you, like, some people are just like, hey, this is exactly what's going on with me. I wanted to let you know. What are your thoughts on this? Or, you know, I've had postpartum depression in the past, or anxiety in the past. So, you know, I'm already seeing a therapist, or I'm in with my primary or my psychiatrist, or, you know, there's all sorts of different ways that people will come and talk to me about this. The most common way that I will say, and to answer your question on, like, you know, what are the common symptoms that you see? It's actually, they don't say anything about this, right? It's they don't say anything about this, but it's more so trying to pick up on the nuances of what they're not saying.
Right.
So when you kind of gloss over, like, you know, how are things going? You know, we haven't slept in 4 years, but no big deal.
I think I literally said that, actually.
Okay. Like, but is that really not a big deal?
Right.
Right? Like, so you're trying to pick up on certain things like this that they're not necessarily saying, but you have to have that intuition and that understand that nuance. When parents come in to see you, especially as a professional, right? They're not trying to be like, hey, I am falling apart right now, and this is what's going on in my life. They want to present themselves as, we are killing it as parents. Like, look at us, like, we are doing amazing, and look at all the things that, you know, my kid is doing and how well we're doing as parents, right? You don't want to come across like you don't know what you're doing, or, you know, people are questioning your parenting.
Yes.
Right? And so if I may be so bold as to say, my recollection of what you went through and watching you through that first year, it was, I heard a lot from you, and then I didn't hear a lot from you for a while. And I think part of it is because you knew that I would see something. right? I
Very
can't
much.
not see you.
Yeah.
When I see you and I'm like, what's your face doing? Your face is making
going
a
on
face.
there?
What's going on? There's something, you're churning something up here, like what's going on? And so I felt a distance and I didn't understand that.
Yeah.
And then when you said, this is what's been going on, and I feel like something is happening to me here, and I don't really understand why this is happening, right?
Yeah.
And I remembered you saying this, and I was so furious at the medical community because I was like, why? Like, did your pediatrician not like screen you for this? Was there not something that was discussed with you? Was this not counseled for you? And you said, oh, 100% they did screeners for me. I lied because I didn't want to seem like a bad mom. I remember you saying that, and I was like, oh my gosh, is a medical community we need to do better.
Yes.
Because this is not putting people in a place where it's opening up the conversation for saying, where are you and how are you feeling? It's saying like, hey, do you have mood issues?
Aggressively.
Hey, do you feel like you want to harm your child? Hey, do you feel like this? It's so isolating and so almost like aggressively like you're the problem here, right?
Yes.
You are the
Yeah.
one that carries the baby. So if anything goes wrong during pregnancy, what's the first thing that happens?
Right.
There's questions about the mom. Are you eating well? Are you sleeping? Are you doing this? Are you doing that? Because you're the one carrying the baby. Right?
100%.
Feeding after you deliver the baby. There's so much pressure on like, well, breast is best. Is it though? It's also our bodies. Do we
Right.
not have a choice?
Fed is
Sometimes
best.
we don't have a choice, and
Right.
we've had medical procedures that do not allow us to have breast tissue to be able to feed our babies.
Right.
Or it's a choice of this is my body and I don't want to do this, or this is my body and I want to do this, but nothing that I'm doing is making this happen
Yeah.
for me, right? So it's all about with feeding your baby even after, it so falls on the mom.
Yes.
Falls on the mom. Doesn't fall on the dad, falls on the mom for this.
Right.
And so many of my parents feel like it's a direct correlation with who I am and my success as a parent is what my body's able to do.
Yes.
Can I carry a pregnancy can I get pregnant? Can I carry a pregnancy to term? Can I have a safe delivery? And then can I successfully feed my baby? So much of this falls to the mother,
Yeah.
right?
So much of
does.
it that is out of our control. How many times I know I've heard, and I know you've heard, we really wanted to have a vaginal delivery, but we had to have a C-section. And it's kind of said in this their voice falls like they've done something wrong.
Oh, they failed. Yeah.
And that's not how that works at all. We all understand that, and yet it's still somehow present as a stigma. It's just, it always blows my mind. So I really agree with all of what you said. I appreciate that you, as a professional, saw me, but also as my closest friend. And yet it took me a really long time to even be honest with you, to be honest with myself. Let's talk about that timeline, because I remember telling you, I think it was about the 6-month mark that I actually started to kind of have some awareness of how wrong things felt.
Yeah.
And saying, well, it couldn't be postpartum depression or anxiety because I'm 6 months in.
Yeah.
If that was it, I'd be over it by now.
Correct. I think that when I said like the medical community needs to do better about this, it needs to not feel so blamed on the mom.
Right.
Right? Like all the forms are about the mom. I don't remember a single form that's like, hey dad, how are you doing?
Which is
how are you feeling?
Right. Yes.
It's so on the mom about like, hey, where are you at? How is your mood? What's going on with you? I think that it needs to be more of a conversation of saying, hey, this is a time frame when a lot of our moms, you know, this is where they're at, this is what they're going through. Have you ever felt this way? If that would have been a conversation that got opened up for you in a place that felt like it was safe and non-judgmental and welcoming,
Yes.
I think that you would have been able to talk through, well, you know, sometimes I do feel that way. It's the same thing when I talk to my teenagers about depression and anxiety. I know why they're coming in. When there's like mood, worsening depression, things like this on my schedule, and then they come in and the teenagers oftentimes they'll be shut down, they'll be, you know, the head is down, the hood is up. Sometimes they wear sunglasses, like they just don't want to talk about it. They don't want to talk about it. So if I say, you know, what brings you in today? Right? They will not answer me. They'll usually look at their parent, because usually it's the parent that's bringing them in as well. And I'll turn to the parent and say like, hey, you know, can you tell me a little bit more about what brings you in today and what you're seeing at home? Right? And then from there, I actually do the talking. And I will start to say things about when I see this is usually the pattern that I tend to see. Your experience is your own experience, and nothing is going to be the exact copy of your experience. But typically there is a pattern of what we tend to see. So does any of this resonate with you? And the amount of times that those teenagers will, like, their eyes will pop up, they'll really start being like, oh my gosh, absolutely, absolutely. What I say is it's really hard to come up with that de novo of saying, like, well, I kind of feel like this, and then I feel like this, and then this happened, and then I feel like this is why I'm doing this, and that's why I'm doing this. Like, if you don't know and understand that there is a very consistent, clear pattern with this, to come up with that and be able to say that narrative de novo is very challenging.
Yeah.
And you don't know what someone else is going to say. Like, ooh, egad, that has happened to you. Like, we've never heard that before. That feels very isolating. It feels very alone. So if someone else could say,
right?
hey, let's have postpartum visits where we're really talking about, like, how are you doing? Overall, how are you doing? Right? I think that would be great, which is a huge part about what I do in my practice during those wellness visits, is not only talking about the baby and how the baby is doing or the toddler is doing, or great, you're adding a second one to the brood or a third one to the brood. How are first and second doing with the third one coming in? How are you guys doing? Right? It's talking about the dynamic within the family. So that is a huge part of what I do, is trying to make sure that everyone is being heard and listened to, but it takes someone to really be able to listen to the nuances and have the time to do so.
And let's talk about that, because that's a perfect segue into, there's this idea when we're talking about this in the film, Afterbirth overall as a project is an effort to get a better understanding of what isn't working and how we can change it. And you and I have spent a lot of time talking about, it's not the medical community's fault per se. No one is making it, nobody is the bad guy here. Doctors are not trying to shirk their responsibilities. My pediatrician, you know, I loved my pediatrician. She was absolutely incredible. The time allotted to you as doctors to see your patients and the amount of things you have to cover inside of that window, there's a mismatch happening there. What do we do about that? How does that change? Can we change it? Talk to me about the amount of time you get to spend with each patient.
Yeah, so it's so interesting because I feel like for certain things, you know the amount of time that you have, right? So like if you go to therapy, you know your therapy sessions are an hour long. If you go get a massage, you know your massage is about like 50 minutes long, or you know 70 minutes long, like whatever it is, right? Like you know these things, but when you go to your doctors, you just make an appointment to go see your doctor. You have no idea how much time they actually scheduled or allotted for that visit. So with what I do for a living and working at the institution that I'm at, this is something where it's 15 minutes for urgent visit. So something like, you know, I got a bum knee, or, you know, I've got a hangnail, or, you know, a cold or an ear infection or things like this. And then it's 30 minutes for anything that's like a well visit where you're going in for your wellness checks, or anything that's mood disorder or ADHD or things like this, right? Behavioral concerns. But that's 30 minutes. And I schedule out about 3 months. So if someone has an issue and they're so brave as to say, hey, I need to schedule an appointment to talk about it, they've waited 3 months to get in to see me now, right? Because it wasn't a previously scheduled well visit, let's say, right? Then I talk to them for these 30 minutes, which is not enough time to actually really be able to do justice to what they're coming in to see me for. And then I say, okay, great, let's follow up here. It is really hard for me to get another visit within 2 weeks, 3 weeks, you know, more often, like I can try to finagle my schedule into about a month, but it's very, very challenging to try to get someone back in as frequently as I would want to see them back, or get the duration of time that I'd want to see them initially while you're already like cracked open and really talking about things, right?
And for people like me, who I don't have an insight other than, of course, through you, but just when I go to my doctor, I don't understand, okay, what, I'm not done talking to you, can I have 10 more minutes? Why is that such a big deal behind the scenes for you? Right,
so there is so much that goes into, I love the fact that we can document through the computer now. It makes so many things so much easier to be able to pull back up and not have paper charts, and to be able to see what subspecialists that we refer to are saying, because we're all in the same charting system, and to pull up labs and see all these different things. I love EMR, or electronic medical record, for so many different reasons. But it also then, instead of being able to chart through more quickly about like, this is what we're seeing, this is what's going on, there's so much documentation that then we have to do after the fact, right? And apparently with mental health issues, it's not formulaic. It's not going to be something, even though there can be presenting features that can be very similar, it's not formulaic. Human beings are not that way.
Sure.
So everyone's experience is their own experience. And so when you're documenting what you talked about, what you discussed, what this person's history was, what they're going through, it's going to be different. And so you have to try to type that in while you're still talking to someone, but also being very present. But I never get everything done when I'm in the room, because I want to be present and I want to be in the room with you.
Yeah.
Right?
Yes.
If I only have a half an hour to do this, but we're talking about, gosh, it's the first time that someone's really recognized certain things that I've been going through. How do you cut that off?
Yeah.
So then I just run behind all the time.
Right.
So I am known in my practice to be running at least about 30 to 60 minutes behind, and people have schedules to keep. People have things that are important. People's time is important. It's also very important to me understanding and recognizing how important their time is.
Right.
Strangely enough, for years upon years, I've been like, my time doesn't really matter. I'm here to serve you. How can I best serve you? How can I best support and care for you?
Right.
Right? But it feels really, really crummy to be running so far behind all the time that I just feel like what they feel is, oh, she's just too busy for me.
Right. And
I never want them to
unfortunately,
feel
that
that way.
is
Right.
the feeling that people have when they're rushed through talking about an issue, or God forbid, don't even want to start. I don't even want to start. And unfortunately, that was something that I, in addition to the judgment and, oh God, they're going to think I'm a bad mom, or she's going to think I don't have myself together. I don't want to burden them with my problems. They don't have the time. That's just not working.
No.
Something has to change.
No, and it's my pediatrician. Like, she's just here for my kid.
Right.
Right? He's
It's
just
not
here for my
about me.
kid. Right?
Right.
Exactly. Like, they're not my doctor. They're my kid's doctor. Well, again, it's the family dynamic, and someone's got to do it.
Right.
Right? I think that it's also, when you were asking me initially, like, what is it, like, how did you decide on pediatrics, right? Well, the way that there are specialties within medicine, it's like pediatrics, there's surgery, there's internal medicine, there's radiology, like there's so many different specialties that you can decide to go into. And one of them is psychiatry. So I think that for so many of us that are in medicine, it kind of feels like, well, yeah, but psychiatry is the one that deals with mental health issues, not us. But who sees the vast majority of patients? Like, we also need to know what to do and how to recognize certain things so that we can get people to the right places, and also not refer every single person that has any sort of challenges with their kids' behavior, with mood disorders for themselves, for their kids, over to psychiatry, because it's too saturated as is.
Right.
There aren't enough providers that exist out there to manage and treat mental health care. And I think that it is a very antiquated way of thinking about medicine, is that there is physical health and then there is mental health. That is bananas. Like, mental health is health, period.
I agree completely.
Period.
On kind of this page of, there's not enough providers, particularly in psychiatry, to help with the mental health crisis that we're finding ourselves in.
Yeah.
And just to touch on quickly, there's a lot of people I'm running into that say, this is just people, making a bigger issue out of nothing, which obviously, I do not feel that way.
I mean, clutch my pearls. Is that okay?
I think the issue is people are finally finding the few avenues where they are being heard and recognized and feeling the comfort and safety of, oh my gosh, someone saw me, and I can actually be honest, very much like me in my own postpartum depression and anxiety. Having my best friend, of course, was amazing, but just having someone look me in the eye and say, this isn't your fault. You didn't choose to feel this way. You're not doing anything wrong.
No.
And then all the times that I said, okay, Linz, I promise I'm going to go find someone, and I would go down the list on Psychology Today, which is great. It's a great resource, don't get me wrong, but I can't tell you how discouraging it is to call and be turned away and be out of network and be not, they don't have enough space in their schedule for me.
Or not even get a call back.
Or not,
right?
That happened
like, okay, so
at
you're
least
there
a dozen
to
times.
care for me and take care of me, and I'm not even worth a phone call back.
Right. And I know that they themselves are overwhelmed. It's not necessarily this malicious intent here. I genuinely believe there's no one out there saying, they're not important. It feels that way though, when you don't get the call back. And it took enough for me to sit and make all those phone calls that half the time, and at least 3 times this happened over the course of my son's first year, I tried to find a provider. The few times I found someone, it wasn't a good match. I didn't feel comfortable, so I had to start all over. And after a while, I just gave up, because I felt like, I'll figure it out. It'll be fine. I'll figure it out.
Well, it reinforces like you're the issue, you're the problem.
Right.
Like you know what I'm saying? There's not that kind of help out there for you. Like you're okay. Just back it up, Buttercup. Come on.
You'll just figure it out. Yeah, put your big girl pants on kind of thing.
So when you were saying like, I feel like this is a crisis that is happening. Do I think that it's been there for a long time? Absolutely. Do I think that this is anything brand new? No. Do I think that there's also a lot more that is like we are in a pressure cooker of a situation? Mm-hmm. Yes. Mm-hmm. But I think that the recognition and the ability of saying like, I don't think I'm okay is, I think uniquely, I will say, I think that it is the Gen Z. Is that the one that our kids are in? I think it's Gen Z.
I think so.
Yeah?
Okay. Yeah, I'm not sure.
Yeah, they're the Zs.
I think so.
The Zs are saving us. I'm gonna tell you, generation by generation by generation, we get better.
Yes,
they are banana smart, and they are the ones that are leading the way and paving the way to say, I am not okay. And it's okay for me not to be okay. Mm-hmm. And it's okay for me to say it and use my voice and stand up and advocate for myself when I am not okay.
Yes.
I deserve to be heard and I deserve to have a voice in this, right?
Yes.
So when I see that in our Gen Z generation coming through here, paving the way and knocking down these walls, I think that that is a huge reason why mental health has been like zoom to the spotlight, front and center, like here I am, I'm not going anywhere, and I've been here for a really long time. Yeah. So our kids are the ones that I think are our saving grace coming through of us recognizing, I don't think I'm okay either. I think that there's other things here, and all of a sudden now it's okay to start talking about this. Yeah. Right? It's really okay to start talking about this. So all the providers that have been out there to be able to help people through mental health issues now are unbelievably swamped by this because it was so underreported what people were going through. Yes. Right? Yes. What people were using for coping mechanisms to help out when they were going through things that they were going through, whether or not it was postpartum depression, like depression that wasn't related to having kids, which a lot of it is related to having kids because that's a stressor, right? With anxiety, with, again, ADHD symptoms, with bipolar disorder, other mental health issues. With all of this, people find ways to cope. It's just not always necessarily healthy coping mechanisms. So when you've got alcoholism in the family, if you've got substance use in the family, if you've got certain things that run within the family, I've never seen that without having mood disorders in the family as well. It is the unhealthy coping mechanisms of trying to deal with something when you were told, buck up, Buttercup, be a man, rub some dirt on it, pain don't hurt. You know what I'm saying? Stop being such a sissy. I'll give you a sucker if you don't cry, right? That kind of stuff. Like, or is it okay for us just to feel the way that we feel? Yep. And be acknowledged for how we feel?
And how much
it got a little bit off topic from postpartum, but in general, there is a mental health crisis that has been ongoing, y'all. It's been here.
It's a common thread, and I agree that it's chicken egg or egg situation, right? Which came first? If there was a mood disorder that was not treated properly, and we fell back on unhealthy coping mechanisms, which so many people do. Absolutely. Here is how we got into this nutshell. Right. So that is relevant.
Exactly.
Exactly. So
and then real fast with that, like, what do you feel then, right? Like you're labeled as an alcoholic, you're labeled as a drug addict. You're labeled as this, that, and the other. So
yet
all
another
of it
thing.
is, thank you very much. It's a shame, shame around shame around shame about not being able to talk about how you actually feel. Yep. So again, mental health is health. That is health. There are so many healthcare dollars that are going towards things that are trying to like mop up all of the shitstorm of trail. Sorry, I shouldn't have said that. But the just trail of like the wake of mental health that is just being ignored.
I agree.
Right? So how about we put more money towards like acknowledging where from the very get-go and from the very start, like, hey, when this happens, let's talk about it. Let's talk about it early so that we don't start to just witness each other falling apart here.
Because there is healing in just even saying the damn 100%. Thing, right? I mean, that how many times do I say that?
Just say the damn thing.
Let's say the damn thing. Because it isn't going to solve it completely, but if we keep putting a Band-Aid on the things that aren't...
Isn't it? Couldn't that?
Right.
Couldn't that be something that actually solves it?
I think it is.
Right?
That's how we've worked for so long. You and I have shared and talked and worked so many things out just by understanding where we're at by having those conversations. Yeah. And I think that that's something crucial inside of postpartum mood disorders, everything. But starting here, I want to talk to you about that problem of timing inside of your profession. I'm not exactly sure that we can solve it here in this moment, but what have you done? I've watched you in the last 6 months to a year get really, really fed up with the way things are. Yeah. And you and I are the type of people, and I love you for this, that if something isn't working, I'm going to try to change it. And if what I'm doing isn't working, I'm going to try something new.
Yeah.
What are you doing that's new?
So I will say that it was something that I have loved working for who I've been working for, right?
Yeah.
Am I allowed to say?
It's up to you.
Okay.
Yeah.
So I work at the University of Michigan. I love the institution. I love my patient panel. I love what they've taught me and how much I've been able to learn from this. But I think that there's been so much of an understanding of the family dynamic within visits for their children that really needs to be discussed and talked about, and they don't allow me the time that I need to be able to really properly delve into this.
Yeah.
And so I think no matter what, even though it's a business of caring, it's still a business. And so for the business model that currently is going on right now, I think that the way to stay above water is by saying, like, we need you to see a certain number of patients in order to make up what we can be reimbursed for and pay your salary with.
Sure.
Right? So I think that this is a business model that is what works for them. It does not work though. It does not work if you're doing due diligence to be able to really delve into the mental health issues that are also going along with this, and not simply only looking at physical health issues, but primarily just looking at this and asking, any behavioral concerns. And the parent's like, just typical toddler stuff, just typical teenager stuff. And you're like, okay, moving on. Like, no, but should we be moving on? Or should we be able to talk about this?
Is it really,
Right?
am I giving you the time to warm up to the honesty that is necessary
Thank
to
you.
actually solve the problem?
Exactly.
Because then your same patients, as we've discussed, are having to come back again,
Yeah.
and nothing is ever actually being stopped as far as the negative cause and symptom and so on.
Right. So I said, this is what I need in order to do my job the way that I need to do it. I need more time. And that was very clearly something that could not fit into this business model. And so I had talked so much to my parents. I call them my parents, but my families, right? So it's not just like my mom and dad, like it's my parents that I work with. And I was saying to so many of them, like, let's just suspend reality for like 5 minutes, because you're gonna talk yourself out of like what you'd want to do if you could for so many of the responsibility issues that you're just like, but I could never do that. So let's just suspend reality for like 5 minutes. And what would you do if you could? And I was like, should I take my own advice? Really think about this? And I was like, okay, well then what I would want to do is I'd want to be able to do something where I could, I had a lecture that I was attending last year that was talking about, like, there's this Venn diagram of, it was Dr. Michael Pitt, who has just like changed my life. And he is one of the program directors over at University of Minnesota. And he was talking about, there's this Venn diagram of what you're good at, what you're passionate about, and what your practice needs. And in the middle where everything meets, like, that's the sweet spot. And I was like, this is it. This is what I want to do. And so what I decided was to open up my own practice of saying, like, let's go. Like, let's really be able to talk about things that are going on here in a non-judgmental space that makes you feel welcome, that makes you feel included and heard. Right? And it's just talking about behavioral issues and mental health issues. And, what questions do you have? I want to do things like walk and talks, basically, where it's just kind of like, let's get out with a general pediatrician and go out and do some exercise, and like ask me any questions that you have that you feel like you're going to be judged if you say in front of your own physician, or you feel like they don't have the time to be able to really get into this. Like, let's talk about things.
Yeah.
Let's really open this up, because the more that we are vulnerable with each other, the more that it builds strength, the more that it builds community, the more that it builds awareness. So that's why I don't think it's that far off with you saying, like, maybe starting the conversation, it may not fix everything, but could it? Could it actually? Because so many people are going through the exact same thing. They're just not telling each other. Right? Because it's scary.
And then the
Vulnerability is
body
scary.
of evidence isn't there, right? So there's this argument, okay, 1 in 5 women have postpartum.
Oh, come on.
Right, thank you. I read that and I'm like, I'm a photographer. I'm not in the medical field. I deal with moms every day.
Yeah.
And we don't necessarily always talk about the medical stuff, but you better believe we always talk about how they're feeling and where they are mentally, because it's the first thing I want to know, because it affects how we interact, how their children can interact with me if they feel comfortable and confident enough to get in front of the camera and really document what's going on, what they want to remember, right? What do I always say to my clients? What do you want to remember? It's okay if you want to remember the perfect, Norman Rockwell kind of look. It's also okay if you want to remember your house being a disaster and your kids not being happy through the whole experience, because that's what's real. And you're gonna miss that too. And it's all relevant. And so I love what you're doing. Taking things out of what has been done, Some of it has been working, but for the most part, there are a lot of shifts that need to happen. What does that look like, and how do we do it? Because I'm sick of sitting around and waiting for other people to suggest it or give me permission. I would just want to start right now.
I think you're doing it.
Oh my gosh, look at us. We're here. We're doing it.
I think you're doing it. It's starting the conversation. It's a hard conversation. So when you asked me, like, what was your experience like with postpartum depression before you got into the field of medicine, which this is what you do now. You see this. You see parents and the way that they feel and how, you know, what their experiences are. My experience with this has always been the people that are vulnerable, that have been asking for help. You get shamed. You get shut down. You get publicly gaslighted that your own experience was not real.
Yep. Yeah.
So it's going to have to take people standing up and saying, no, this has happened to us.
Right.
And it does not reflect on us as parents, as who we are, as how much we love our kids.
Yeah.
It's not something that we've done wrong. It's something that's happening to us.
Yeah.
And this is not okay.
Right.
That we need to stay silent because of fear of shame.
Fear of shame,
Right.
fear of embarrassment, fear of judgment from people who frankly have no room to judge us anyway.
Right.
Stay in your own lane.
Right.
And one thing I want to ask you about, because I think it's really relevant, I have talked to friends and clients that have said, gosh, you know, my kids are older. I didn't really ever stop to ask myself while I was going through it if that's what was happening, because things just felt so chaotic.
Yep.
And I have a number of friends, one in particular that will be participating in this, that has said, you know, I don't think I've ever dealt with it. I'm still just holding on to it. It's still just living inside of my chest. And every time, and I struggle with this myself, and I know you know this, every time someone says, gosh, you're such a good mom, I can't receive it.
Yeah.
I can't.
Yeah.
In fact, it is a visceral, physical reaction that I have to, no, that's just not true. When I know that it is, I am a good mom and I love my kids and I give them as much as they need and beyond.
Yeah.
And it fulfills me too. Why can't I take that? Why can't I receive that from people?
You know what I wonder though with that specifically too is that for so long when you were trying to be okay, right?
Yeah.
It was just like, I just want to be okay. I just want to be okay. And so it's not that, like with depression, with anxiety, it's not that you can't appear okay or that you also can't have good days.
Oh yeah,
or that
there
you
were
can't
lots
have
of great
moments
days
where there's joy or happiness or laughter, right?
Yeah.
It's just kind of exhausting. It's really, it's just a lot. It takes a lot of energy to do this, right?
Yes.
But I think that part of that, when that happens, I wonder if that harkens back onto your experience when everyone didn't notice. And so when that happens and someone says this, it's like, oh gosh, am I masking again? Oh gosh, do you know what I mean? I just wonder if there's like a little bit of that's like, oh gosh, like are they, because I know that I'm a good mom, but at the same time, like I also have flaws. I also like, did you see my kid tantruming over here just a second ago? Like, did you hear the phone conversation where I said, I'm gonna have to call you back because Cleo just pooped in the sink? Like, you know what I'm saying? Like, it's that kind of stuff.
True
where
story.
Just like, right? Like that is real life, but that doesn't mean that you're not a good mom, right? I mean, that is all the greatness, but I think that it is really hard for us to sometimes accept that and to accept compliments in general. It's because we're just not supposed to be accepting compliments, right?
You don't want to be
just say no.
A certain, some kind of a way, right?
Real fast, can I touch on that though too? Like the idea of like what it is to be female, what it is to be male in a traditionally like binary world, and what it is and why the experience seems to be so much different for moms than it is for dads.
Yes, please.
Right? So for moms, I think that some of the way that we are very, very hardwired as females versus the way that men are hardwired is we are natural nurturers, right? And our men are natural providers and protectors. So in this very like, again, kind of like antiquated traditional gender role way, but there are certain ways that we are genetically hardwired. So there are certain aspects of where it comes down to us as natural nurturers. So again, we carry the children, we are in charge of, you know, breastfeeding the children or feeding the children in general. We micromanage with the best of them of like, you got the wrong size diaper, that's the wrong kind of milk, I'll just do it myself. Like you didn't wash it in the right laundry detergent, it needs to be washed and dressed. Like doesn't really matter. Like, I don't know, right? So there's so much that we do that's like this natural nurturing, right? And whereas the men, they are the providers, they are the protectors. So part of what I think is so exhausting, especially within that first year, the first several months, right, of that feeding and waking up is, especially as first-time parents, there's a little creature that cannot be like, yo mom, like I'm hungry, yo mom, I'm cold, like papa, like I'm, get me a bottle. Like they can't do that. They can't communicate in any other way other than crying.
Right.
And who do you think is hardwired for the crying? Right? Like we're the ones that are hardwired for the crying.
Physical response,
absolutely,
even still.
Absolutely,
Yeah.
right? And so
Yeah.
it's so much different when you're just like, hey, can you wake up? And the amount of moms that I will have that are just like, I will say, can you get up with him in the middle of the night? And he's like, yep, totally can. And while I'm laying there awake, he's like, completely out as our baby is screaming in the other room.
Right.
And I'm like, not his fault. Still not dad's fault though. It's
Right.
not dad's fault. It's not that he's like that exhausted. I mean, yes, he's exhausted, but it's not that he's that exhausted. And it's not that he's like trying to shirk responsibility here.
Right.
If there was a window that gently broke, if there was a door handle that was like jangling, he would be up so fast, lickety split. He is hardwired to protect the pack, right? The family, the domicile. Like he is hardwired to protect this. But when the baby has kicked his sock off and has fussed a little bit, he's not hardwired for that, right? Like he's fine, like we're good. So we can't hold our partners, our male partners, to this expectation that you should just be exactly, like react the same way that we're reacting to everything.
Absolutely.
Right? And that you should feel the responsibility that we feel for everything. It's just not the way that they are hardwired.
Yes.
Right?
And it takes time, right, to have the conversations of, hey, I realize this isn't your instinct, but it would mean a lot to me if this could be a priority to you. And I know in my experience and the experiences I've watched with my friends and clients, they want to help. Dads
100%.
want to help. Drew wants to help.
100%.
He will get up if he knows it is important to me and it's something I need. But until that communication happens, they are doing their best with the information they know. They don't know what they don't know, right?
Yeah.
We don't know what we don't know is needed from the person, be it a partner, a friend, a patient.
Yeah.
Unless
Absolutely.
they have the room and the space and the time
Absolutely.
to say it.
So I will tell the parents, right, you need to take a day off per week that is your day off, right?
Yeah.
At least a half a day to a day off that's your day off, that you do whatever you want to do, hang out with the girlfriends, go out, golfing, go hunting, fishing, biking, whatever it is. I used to accept exercise as something where they would just be like, oh yes, I work out. And I'm like, I used to accept that, and now that feels like, oh, I ate lunch today for myself. And I'm like,
I showered.
is that really what we're going for here? Like, probably not. Like, that is like a normal human need, right?
Sure.
So no. Something else, that in addition to something else for yourself, right?
Right.
The other thing that is very challenging with this, when I can get the parents on board for this, is the fact that usually the dads are actually much better about doing this for themselves. But when they do this, it's usually the moms that then come after them of saying, like, when they come home and they're just like, yeah, me and Bob are going out for a drink later on today, or we're gonna go out, to go shoot clay pigeons or something like this. And the mom's like, I'm sorry, I must have hallucinated for a second. It sounded like you were at work all day. I was at home with the kid all day, and then you're coming back to change clothes to then go out again. I'm just making sure that I wasn't hallucinating, right? Is that what you were telling me? And they make them feel so badly, unintentionally, but make them feel so badly for doing this that they stop doing it. Right?
Yeah.
And then they grow resentful because they don't have that time that's necessary to be who they are.
Right.
Right?
Yes.
So we're not doing that. That's what I tell my parents all the time. We're not doing that.
Let's
we're not
just
doing
skip
that.
it.
If the parents, the other partner is saying to, especially the mom, please go out and do this for you. Please go out and take care of yourself. What do you need? Go out with your girlfriends. Go out on a trip. Go do this. Go do that. Go do the other. It's oftentimes moms that will actually find ways of not doing it. We'll actually just turn it away and just be like, no, because it feels like shirking responsibility for our kids. Like, but these were my kids. I wanted these kids. Putting responsibility on anyone else just feels like I'm a bad parent for doing so. Like, I got it. I don't need this.
Yeah.
So then they don't do this, and then their partner doesn't do this. So it is this cycle that happens because we want the time, but at the same time, we will actually refuse the time because we feel like it's taking away from other people.
Well, and you and I mean, we've talked about that as well firsthand. And I want to go back to all of this is connected, right? How many times have I said, all of these issues are connected. We just have to do a better job of expressing the way that connection is happening for us so that the community can understand. And then we can start to create the patches that help fulfill the needs that are not being met. Brene Brown, what is not being said, what need is not being met.
Yes.
We're meeting a need here.
Yes.
As far as the medical community, what is the future?
Yeah, really great question. So I think that we need to start understanding, I think it's such a systemic issue of what this actually really looks like. I think that it's a really, really big ask here, but I think it's an overhaul entirely of what needs to happen. I think that it needs to get back to the idea of patient care and like whole patient care and not just like this part over here, this part over here, this part over here. Like it really needs to be an overview of, hey, what can we do to make wellness more of a priority? Right?
More health and our mental
exactly, right? And so that is part of our overall wellness is feeling supported, feeling validated, feeling like we have a say, feeling that we have agency over ourselves, feeling that it's okay for us to not be okay. Right? So I think that the industry needs to change altogether in the way of focusing more on overall wellness. And I think with that, it comes with insurance changes, right? The reason why I have 15 and 30-minute appointments is because we only get reimbursed so much and we have to also make a living. So within the healthcare industry, that's what they tell us is that we can have time. I think we need to start saying like, but this is what we need. Like stop telling us what you're gonna do and give us, and how about we actually tell you what the need is and you're gonna support us for what the need actually is. That is where I think this is gonna change. But I think that going from what insurance pays out for all, like I said, like the wake of the unsaid, right? If they could put that money towards the support up front and actually allowing us to have the time that we need and allowing us to get people into therapists, allow people to actually have greater access to mental health services. Right? That's where the change is going to happen. Once there can be more of an understanding of that is the direction that things need to go, and we need to put more money towards the front end instead of trying to, you know, pick up the wake
Mop up
of
the water.
Exactly. We're not doing that. We're not doing that. So like that's where I think the biggest change needs to happen. I think anything beyond that is then going to trickle down to say like, okay, well now insurance is going to reimburse you more so that you can take the hour to do this. Then we can actually increase the amount of providers that exist out there so we can increase access to care. We are going to train other people to recognize the symptoms and really do more visits regarding postpartum depression. What are you going through with your teenager, right? Like, let's walk you through what preteens actually need and how to catch up with where they're at and their ever-changing needs as a parent. Right? What is your teenager going through? It's the whole gamut. And then as a parent, it's more of like a sigh of just, okay, like we're just in it, like strap in, here we go, because it's gonna be clunky and you're never gonna feel like, oh, I finally have got it. Right? There's never gonna be that moment.
I want you to take a minute and tell me, or at least I want to get this on film. I want there to be, and I know you do too, more education about postpartum depression, anxiety, potentially OCD, once we get a little more research around that, on the front end, prenatal education, so that more than just a flyer taped to the wall of the doctor's office, we are aware of what to look for. So the minute those symptoms begin to happen, we say, whoa, I recognize there is a problem, and we don't get 6 months in to a point where we're so far down we don't even know how to look up and see light anymore. I think education, conversation before you're deep in the woods would be a huge game changer for postpartum mental disorders.
So I think as a mom who's been through it, like what would be your biggest recommendation for this, for the medical community? Would it be, you know, starting with the OBs? Would it be with the pediatricians? Like how would it be the easiest for you to receive that information as well? Because again, as a new mom, I've seen my parents come in and they're like bleary eyed and their hair's all over and I'm like, how are you doing? What do you need? What do you need? How can I be here? You know, sometimes it's like, it's so much over information that it's like, it doesn't even land or it doesn't even hit, or it doesn't seem applicable to me right now. So in what ways can we actually meet the needs of our patients as well?
That question is fantastic. I think two big pieces of advice I wish I would have heeded would be, there are a lot of great books, there are a lot of great podcasts, but don't overindulge in information about baby and what could go wrong and what the risks are. You will figure that out as you are learning. I'm not saying don't read any books, but I know I went bananas. I read way too much and I was way too aware of what was going on. You know, John talked about those fetal monitors that you can put in the crib.
I don't like them. I don't like them. The owlets. I'm a huge not fan of them.
I get why they exist. It's great, but that would have been a huge issue had Drew just shut me down and was
they alarm way more than they actually do anything that's really beneficial. 100%.
The other thing, though, would have been, and what I want for after birth, is to get on, with the OB side of things, birth centers, places where you go take Lamaze classes and you learn for 3 weeks how to breathe while you're having the baby.
How do you breathe after having the baby? Exactly. I love that idea. Yes.
Exactly. Let's learn how to breathe
Yeah.
once baby is here. Because I held my breath for a year.
Yeah.
And it didn't work.
Yeah.
So.
It's not okay. It's not okay.
I can't thank you enough for being here. Not only is it special to me to have your knowledge, your expertise, your energy, because it's my favorite, but also just to share in this project, because you know how very invested I am in it, and to have you be a part of it, there's just no other way this could have gone down. So thank you.
I love you so much. I'm so proud of you. And I can't believe that I can. That's the thing. Like, you are hands down one of the most fearless women I have ever known. You don't take no for an answer. You see possibility and beauty in everything. And I think what is so fantastic about you specifically is how much everything that you do is about lifting people up and about building people up and empowering other people. And this is such a tangible, visceral thing for you of being able to say, there is beauty in everything. There is beauty in everything of what you're doing. There's no cookie cutter one way of doing this right.
Yeah.
I don't have it all together. No one has it all together. And that's so genuine and unifying, and just, it makes people feel seen and makes people feel heard. And that's why you connect so beautifully with other people. So I'm so proud of you for doing this. This is such a huge step forward in awareness, because this isn't going anywhere anytime soon, right?
No.
And I think that vulnerability aspect of what you bring to this is just, it's so powerful. So I love you. I'm so proud of you.
Thank you.